Dementia, as you know, it's an umbrella term for loss of memory and other thinking abilities. And it has to be severe enough to interfere with daily life. And majority of the dementia, you see, is Alzheimer's, 60 to 80%. But there are other types of dementia too. So not only the Alzheimer. You can have Lewy body dementia, 5 to 10%, vascular dementia due to strokes, frontotemporal dementia, 5 to 10%, and the other types, Parkinson dementia, Huntington, rapidly progressive dementias. And sometimes you can have multiple pathologies, what we call mixed dementia. What is dementia and what is normal aging? And we all age and we do have a little bit of memory loss. That's not dementia. So in a typical aging, patient complains about memory loss, but able to provide detailed examples of forgetfulness. You know, I forget that, but I forgot that thing, right? Occasionally searches for words. May have to pause to remember directions, but does not get lost in the familiar places. Yeah, as compared to the dementia patient, they get lost in familiar places and take excessive time to return home. Remember recent important events. Conversations are not impaired. So if they're talking to somebody, they're not going to pause. Notable decline in memory for recent events and ability to converse. And some interpersonal social skills are at the same level as they have always been. So typical aging, you are most of the time independent and your judgment is preserved. As compared to dementia, you do lose your judgment and independent living. So this graph is very, very important to understand dementia. So this is the time in years, and this is your cognitive ability. And let's say we are here at 50 years, and as we get older, there comes preclinical state where it's a silent phase. For several years, brain changes without measurable symptoms. Individual may notice some changes, but less detectable on tests. And a stage where the patient knows, but the doctor does not. So they keep on saying, I have memory loss, and I do all the tests, everything coming normal. Then you go to a milder stage. It's called mild cognitive impairment. It lasts for a few years. You see this, right? And then cognitive changes are of concern to individual and family, so get little more pronounced. One or more cognitive domains impaired. So they have either trouble with the concentration, recall, visuospatial orientation, a lot of other cognitive abilities. But they have preserved activity of daily living. So this is a state, if you catch it early, we can put on some medication to delay the onset of the dementia. And then when the cognitive impairment is severe enough to interfere the everyday abilities, that's what we call dementia. And it can go mild, moderate, severe, and severe. So it's a slow decline throughout the age.